Hello, my name is Lucia Marie Turpak. I have a master's degree in medical anthropology from the University of Colorado, Denver, and I currently work as a professional research assistant and program manager for the Program for Injury Prevention Education and Research at the Colorado School of Public Health. The title of my presentation is The Phenomenology of Ibogaine-Assisted Addiction Treatment, Understanding the Role of the Psychedelic Experience in Healing. This presentation is based on findings from my master's thesis. It's a bit of a challenge to condense this information into a 10-minute presentation, and I would encourage you to pause the presentation at any time to look more deeply at the slides if desired. Special thanks, of course, to the Source Research Foundation for supporting this research. So in America and elsewhere, we are in the middle of a devastating opioid epidemic. Overdose deaths are on the rise, and opioid use disorder is particularly difficult to treat because of low response to rehabilitation and high relapse rates. The main form of treatment available is opioid maintenance treatment, such as methadone and Suboxone, which can also result in overdose and other harmful or undesirable side effects. So how is addiction conceptualized and treated? There are competing models to explain the causes of addiction. These models in turn implicate different treatment modalities. Today, both the US government and the medical system largely consider addiction to be a biologically based disease of the brain, a chronic relapsing brain disorder. The brain-based view of addiction is touted as a progressive alternative to previous conceptualizations which viewed addiction as strictly a moral failing of the individual. Addiction is widely compared to other chronic diseases such as asthma or diabetes, diseases which can be managed but not cured. Although a growing body of literature is pushing back against and complicating the brain-based disease model of understanding addiction. For example, the famous Adverse Childhood Experiences study elucidated the link between childhood trauma and addiction. As more adverse childhood experiences were reported, the presence of addiction increased. Many of us are also familiar with Gabor Mate, who argues that rather than asking why the addiction, the question we should be asking ourselves is why the pain. Addiction then can be conceptualized as a survival strategy to allow those who have suffered trauma to cope with symptoms such as reenactment, persistent expectation of danger, hyperarousal, and numbing in a way that allows them to function in the world. What is Ibogaine? So Ibogaine is a non-addictive psychedelic alkaloid derived from the root bark of the West African shrub, the Tabernath iboga. Iboga was traditionally used and is still traditionally used in the Bwiti tradition for rituals and rites of passage. In the United States, Ibogaine is categorized as Schedule 1, meaning that it has no medical value and high potential for abuse. However, unlike other classic psychedelics, like LSD or psilocybin, Alper and team showed that the primary reason for taking Ibogaine is to combat opioid withdrawal. In the academic literature, Ibogaine has been deemed an addiction disruptor. After just one Ibogaine session, many patients report a mitigation of withdrawal symptoms and cravings, as well as other positive benefits. In a 2001 paper, Alper described the 3 subjective phases of the Ibogaine experience. According to Alper, during the waking dream phase, individuals have the opportunity to return to the moments when addiction began. Evaluation of one's trauma and life experience then begins in phase 2. Other research has cataloged how the subjective experience may facilitate healing by allowing individuals to, as Schenberg describes, become aware of the multiplicity of causes and reasons that may drive their drug abuse, and release repressed memories as a result. So in researching the subjective experience of the Ibogaine treatment, I was really interested in understanding how the visionary experience elicited by Ibogaine is facilitated and mediated by doctors and psychologists. I was also interested in understanding the narratives that patients established about their Ibogaine experiences. Anthropologists have long understood healing to be a performative act, with meaning-making being crucial to successful healing. Anthropologists elucidate the ways in which explanatory models of illness are established not merely as empirical and factual description of disease, but rather as therapeutic tools to assist in a sick person's healing processes. Okay, so on to study goals. The three main goals of the study were one, to understand the limitations of current biomedical approaches to addiction that encourage patients to seek alternative treatment modalities such as Ibogaine, establish a deeper understanding of the therapeutic role of the psychedelic experience elicited by Ibogaine treatment, and number three, critically examine the category of addiction and investigate the underlying causes of addiction as perceived by those who enter Ibogaine treatment as well as those who provide Ibogaine treatment. Methods. So to answer these questions, I conducted a month of fieldwork at an Ibogaine detox facility in Mexico, which I will now refer to as Ibogaine Treatment Center. That's not the real name, and any names I use of patients are all pseudonyms as well. At ITC, I used convenience sampling to recruit 7 patients, all 3 psychologists employed at the facility, and the medical director to be part of the study. 6 of 7 patients recruited for the study were from the United States, and 1 patient was from Canada. All patients recruited were receiving treatment primarily for opioid addiction. However, the heaviness of patients' habits varied, and some patients were polydrug users. The crux of the data collection occurred during pre-treatment, post-treatment, and 1-month follow-up interviews with patients. Something to note, unlike Ibogaine clinics, which may be oriented towards a more psychospiritual sort of program, or even a Bwiti-based program, Ibogaine Treatment Center is a hyper-medicalized program. The clinic has a distinct Western feel, and treatment is usually very quick, lasting only 7 days. Okay, on to the findings. So what are the factors which lead addicts to seek treatment at ITC? So number 1 are negative perceptions and experiences with standard available treatment options for opioid addiction, and a sense of desperation, a willingness to try anything. Number 2 is a desire to be free of all opioids, including opioid maintenance treatments. So I'm going to dig into this one a little bit. OMTs were described as evil and too expensive and just another way for pharmaceutical companies to make money. Patients were also critical of what Philippe Bourgois calls repressive micrologistics involved with OMTs, including the need for daily visits, drug tests, as well as the general lack of trust between providers and patients. Patients also complained about the lack of effective tapering protocol and a desire to be free of all opioids. Undesirable side effects and difficult withdrawal process related to opioid maintenance treatments were also reported as reasons why patients ultimately decided to try Ibogaine treatment as an alternative. Other reasons for trying Ibogaine treatment were a promise of a quick, painless detox. This is a 1-week-long treatment. And then number 4 is interest in a plant-based treatment with a psychedelic or spiritual component. Okay. So for the sake of this short presentation, I'm only going to be covering 3 of the salient themes which emerged from my interviews with patients after their Ibogaine treatment. So several patients described experiencing various physical sensations and auditory effects, which they attributed to the Ibogaine treatment. To some patients, physical and auditory effects were proof that Ibogaine was working to reset their brains and rewire their neurology to free them from addiction. As patient Charlotte described, they say it sounds like it's scrubbing your transmitters. It sounds like it's scrubbing your transmitters, as she laughs. That's exactly what it feels like, just buzz, buzz, buzz for hours. Patients also experienced insights in healing related to potential root causes of one's addiction. Several patients described receiving insights related to underlying feelings which they believe drove their addiction. Liam attributed his underlying anxiety to growing up with what he described as a neurotic mother and a withdrawn father, but during his treatment was also able to experience acceptance around his childhood environment. So another patient who had an experience of severe trauma from a young age explained, Ibogaine really helped me to just accept the fact that I can't change the past. So I needed to make an agreement with myself right here and now to accept the fact that this has all happened and come to terms with it, or else I'm just going to drive myself effing crazy for the next however long I decide to keep a gun out of my mouth. Another theme that emerged was the experience of communicating or communing with the Ibogaine. Ethan also had the experience of asking the root for guidance and argues that his belief in this, quote, crazy West African psychedelic root, unquote, has kept him sober post-treatment. These are just a few themes to elucidate that aspects of the psychedelic experience outside of just the mitigation of physical withdrawal symptoms and craving played a crucial role in healing from addiction for some folks in this study sample. So now I will circle back to briefly discussing conflicting explanatory models of addiction at ITC. So Dr. Flores, the medical director, his explanatory models of addiction are shaped by his understanding of addiction as a chronic relapsing brain disease. From his perspective, addiction is a physical problem, a result of a hyperactive reward system. The psychedelic experience is considered to be a side effect and is therefore devalued by Dr. Flores. And I'll also add that this could also just be an effect of trying to distance himself from more psychospiritual programs and create a program that feels medically legitimate and a place where people can feel safe. So on the other hand, the psychologists at ITC have a much more holistic and biopsychosocial understanding of addiction, as well as the role of the psychedelic experience of Ibogaine and its potential to help in treatment. So the medical director and the psychologist also have very different ideas around the role of the patient belief and meaning making in treatment. In fact, the psychologists argue that belief in the treatment, openness, and patient buy-in are all crucial factors in making the most out of Ibogaine treatment, as well as setting oneself up to have a meaningful psychedelic experience. So the findings from this study suggest that the standard biomedical understanding of addiction as a biologically based disease is too reductionistic and fails to consider the multitude of other factors which contribute to addiction. In addition, standard biomedical treatment available in the U.S. for addiction is perceived by patients at ITC to be ineffective and undesirable. So the findings from this study also suggest that in addition to working physiologically as an addiction disruptor, Ibogaine also works on psychological, emotional, and other levels which help patients heal from addiction. In order for Ibogaine to be as effective as possible in treating addiction, it is imperative that researchers and providers pay attention to the patient's subjective experiences, as well as tactics which can be utilized to maximize the benefits of this subjective experience. The findings in this study also support Schoenberg's suggestion that Western medicine must make a conceptual shift from analyzing psychedelic medicines in terms of, quote, drug efficacy to analyzing psychedelic medicines in terms of, quote, experience efficacy. This shift must also be coupled with a shift in biomedical explanatory models of addiction. Addiction can no longer be solely understood as a physiological disease of the brain. Okay. And references. Thank you so much, everyone, for attending my presentation. I am happy to take questions. Please remember that this was for my master's thesis. I'm kind of considering this to be an exploratory study, which I hope to build off of using hopefully more mixed methods research. But it was such an honor to be able to present, and congratulations to ICPR for putting on such a great event. Thank you all so much.